Hi, I'm Heather Mendoza. I'm a psychiatric nurse practitioner, and I'm here to educate you on bipolar disorder. So, what is bipolar disorder? Bipolar disorder is characterized by recurrent episodes of depression and mania or hypomania. Let's discuss the different types of bipolar disorder. We have bipolar I, bipolar II, and cyclothymic disorder. With bipolar I, it's when a person is diagnosed with manic episodes. Bipolar II is depressive and hypomanic episodes. Cyclothymic disorder is a milder form of bipolar involving many mood swings with hypomania and depressive symptoms that occur frequently for at least 2 years in adults and 1 year in children. Mania, hypomania, depression. Mania is a distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently goal-directed behavior or energy lasting at least 1 week. Hypomania, a distinct period of persistently elevated, expansive, or irritable mood lasting throughout at least 4 days. Hypomania is a milder form of mania. Depression, a persistent feeling of sadness and loss of interest. Let's go over mania warning signs. So a lot of times these patients are not sleeping, they're having excessive energy, even though they're getting no sleep or very little sleep. They're talking faster, the ideas are flowing quickly. As you see my little guy on the side, he is an example of his ideas flowing quickly. So this is how it could possibly sound like with pressured speech and his thoughts just going. I feel great. I need to start a business. Money comes fast. Oh, did you know I can sing? I should be on TV. Anyway, the colors in this room are amazing. Let's go to Vegas. Talk about depression. So depression can look like persistent sadness, less talkative, isolating themselves, not really having a care or interest in people or activities. They could be sleeping too much, too little, or just having disrupted sleep. There are four neurotransmitters that are involved in bipolar disorder. We have serotonin, which regulates our mood, sleep patterns, sexuality, anxiety, appetite, pain. Dopamine is our body's reward system, such as pleasure and arousal. Noradrenaline is most known for effects on alertness, arousal, decision making, focus. And then GABA helps regulate its brain activity to prevent problems in area of anxiety, irritability, concentration. Causes and risk factors, genetics. Do you have a first-degree relative, such as a parent or sibling with bipolar disorder? Periods of high stress, such as death in the family or loved one or another traumatic event. Drug or alcohol misuse, or biological differences. Diagnosis. To diagnose a patient, we need to do a clinical interview and gather history. If we have the opportunity to gather collateral information from families, partners, I would take that opportunity because sometimes the patients might not remember everything. Rule out other causes. So if they have medical issues, thyroid, seizures, brain lesions, substance use, stimulants, steroids, antidepressants, other psych conditions, because borderline personality or ADHD could also look like bipolar disorder. There are also tools we need to use to help monitor and measure these patients for bipolar disorder, such as a mood disorder questionnaire for manic and hypomanic episodes, and then Young Mania rating scales for severity of manic symptoms, PHQ-9 for the depression. There are treatment options, so mood stabilizers, antipsychotics, antidepressants. So gold standard treatment for bipolar disorder is lithium. Um, Another key fact is you do not want to start a patient on an antidepressant that has bipolar disorder without them being on an antipsychotic or mood stabilizer first, as it could send them into a manic episode. Therapy, lifestyle changes, sleep, routine, exercise. Sleep is a major one for these patients. If the sleep gets thrown off, it can send them into a manic episode as well. So I always highly suggest getting normal hours of sleep, 7 to 8 hours if possible. Also educating their families, having a good support group for the patient. People all over live with bipolar disorder and you just may not know it. I think it's good to talk to others about it and that way we educate everyone around us. So it's treatable and manageable. Talk to your provider about it, talk to your friends, your family. That way we can get it out there and so people really understand the true definition of bipolar disorder. So we're going to go through a couple questions. I'm going to let you read this on the screen and I will stay here for a couple minutes. And then you will find the answers in the comments below. Thank you for visiting. Please hit subscribe. There will be more videos out weekly.